that this is an annual affair, that Delhi will suffer with high pollutants in the atmosphere, dirty air, high pollution levels every year. But this year, it could well be a double whammy. And that's why we have to be very, very conscious, very, very careful, and honestly, quite worried. Already, figures are showing, satellite images are showing that stubble burning in surrounding states is 3 times what it was in all of 2019. That's just in the first few days of this season. There is already a political fight that's broken out between state government, central government and other state governments, all finger pointing as to which agency is actually responsible for the increase in pollutants. Meanwhile, the Supreme Court has stepped in and asked former retired Judge Madan B Lokur to set up a commission and oversee what really is happening with this stubble burning. So can we hope for some relief this year round for the capital of India? And secondly, how dangerous can this get coupled with COVID-19? To speak on all this and more, I'm joined this evening by Kailash Vasdev, Senior Advocate in the Supreme Court, and someone who is very familiar with the legal battle against pollution. Jyoti Pande Lavakare is joining me. She's the co-founder of Care for Air. And I'm also speaking today with Dr. Vivek Nangia, the Principal Director and Head Pulmonologist at Max Super Speciality Hospital in Saket. So welcome to all of you and thank you for speaking with us. Mr. Vasdev, let me just come to you first on the Supreme Court decision today to appoint a commission to actually look at what's happening with stubble burning, and retired Justice Madan B Lokur at the head of it. Do you think that that will, in a sense, be a game changer? Because there is so much haziness out there on how much stubble burning contributes to air pollution. Is it 4%? Is it 6%? Is it local factors? Who is doing it? Which states are doing it? Do you think that we can hope for some clarity at least?
Good evening. Look, even if you get clarity, you won't stop stubble burning. Clarity is the cause. The cause is stubble. Question is, how do you get rid of it? Over the many years now, there have been huge attempts to get rid of stubble burning because the machines which have now come in for the purposes of harvesting the paddy crop do not remove the stubble for less than 3 inches above ground level. So you always have that little margin of this paddy stock which remains in the ground. In the many years that this issue has taken place, the governments have always said we want more money to remove the stubble. They tried to follow a pattern 3 years ago when I was amicus in the High Court of installing a particular machine which is used in the United Kingdom and in Europe, which takes out the stubble of all kinds of crops, be it grains of any kind, and converts it into mats. That machine was also imported, but that apart. The old system which the farmer followed of hand cutting the stubble with sickles has now gone. It's all become mechanized. So therefore, he needs a quick turnover for the purposes of planting the next crop, which is wheat. What does he do? He burns the stubble. So that is not going to stop as far as the farmer is concerned till you don't bring about a substituted system for his benefit. He is the man on the ground who suffers economic crisis at all points of time, whether it is stubble burning or the policies of government. Now, you have spoken about Justice Lokur being appointed for the purposes of looking into stubble burning issues. I assume for the sake of argument that Justice Lokur is able to find out some way that Supreme Court can give directions. I don't think the states will follow it because it's become an economic matter. In the proceedings which were started with the Delhi High Court, the demands of the state of Punjab were 9,600 odd crores for purposes of carrying out new systems of eliminating stubble burning. Haryana did the same thing. UP is doing the same thing. They're all wanting money for this purpose. Money is not an answer to stop pollution. The answer to stopping pollution is to take action on the ground, which no government wants to take for political considerations. Till you don't have some kind of a system coming in where these things can be attended to, this problem is going to be with you. The poor farmer is going to keep suffering, and the governments are keep ranting between each other. We want money, we don't bother about pollution. Justice Lokur is a very tough man, and I hope, and I sincerely hope that that he sincerely is able to do something.
Sure. I was just pointing out that the rural economy is now booming, which is great. This might indirectly lead to even more stubble burning. But the big picture is, and let me come to Jyoti here, that it's not only about stubble burning, right? These are local factors as well. And I want Jyoti to come in on this. It's not only about stubble burning, it's local factors. We've discussed this, and it's well known that, the way Delhi is located also contributes to air getting trapped, etc. Are you happy with the kind of measures that have been announced this time round? Sitting in Mumbai, it seems like there is quite a bit of alacrity in putting in rules of banning gensets, etc., traffic lights and switching off your car at traffic lights, etc., etc. Do you think that enough is being done in terms of regulations, or would you like to see more?
So the first thing I'd like to say is that everything that has been announced is reactive. This needs a full-on planning, and you can't have band-aid for a gaping wound. Now, stubble burning, different people are coming up. It had to start back in April and May when farmers were beginning to plant. You cannot do anything now. You can't tell farmers don't burn and not offer them an alternative. It's too late to now start all this pusa, decomposer and all these things. Crop stubble burning does actually cause almost 44%. And I've got this from the CPCB chief as of last year. When the fires peak, which will happen towards the end of October last year, there were 4,000 fires by October 31st, and that led to almost 44% of contribution to air pollution in Delhi itself. And this was by the CPCB chief who gave us these numbers. So you have a reactive policy coming in. Yes, we have a lot of announcements being made, but this should have all been done a while ago. You can't start literally firefighting at this point when everything is on a reactive basis. I'm happy that there is some movement and some announcements being made, and I'm really glad that we have Justice Lokur, who is known to be a very fair and strong man to handle. So it does look like they are taking things a little more seriously this year, but there are actually, for the last 4 years, I think the fact that there can be zero tillage, the fact that you have decomposers, none of this has been done in advance. We have Punjab, and all of this has become so heavily politicized, and our air has become, bad air has become so normalized. Yeah. We are used to breathing. Today, actually, it's a little bit better than other days, but we are constantly breathing air where PM 2.5 goes up beyond 300. WHO levels are limit of 10, actually. India has a limit of 60, but we are way above that. And now with COVID coming in, it's going to be a double whammy. So I'm absolutely not happy with the reactive kind of...
So this is what...
Yes?
Yes. Yes, you mentioned about COVID coming in, and that's important. That's why let me go across to Dr. Vivek Nangia. Are we exaggerating the threat about air pollution plus COVID? What does the medical bodies say? What do the medical bodies say? What do you think about this combination, and could this truly be dangerous?
Yeah, actually, there's no rocket science involved in understanding the effect of pollution and COVID both on the mankind. And this I'm saying because we know very well the WHO has actually identified air pollution as the single most hazardous environmental factor on the health of human beings. And air pollution is known to result in deaths probably more than those with combined effect of AIDS, malaria and tuberculosis put together. So these three diseases and air pollution alone causes more deaths than these three diseases collectively. And now we know very well that air pollution results in diminishing the immune response, especially of the respiratory tract, to any kind of infections. And COVID-19 or the coronavirus is basically a respiratory virus, which is resulting in pneumonias, ARDS, and subsequently other organ involvement. So this goes without saying that on one hand, air pollution will be reducing our immunity towards any kind of a respiratory tract infection. And on the other hand, we have a COVID-19, which is raging pandemic, which is not showing any signs of abating, at least in the near future. So there's no rocket science involved that you have a host where there is a decreased immune response. And on the other hand, there's a virus, which is actually raging at this moment. So obviously the number of cases are going to go up. And this is not just, I'm talking about simple logic, but also there are studies to support that, what I'm saying. There are studies from China which have shown that whenever there was an increase in the air pollution levels, then the number of COVID cases did go up significantly. In fact, there is one study from Harvard which has also linked it directly with the mortality. That when the PM 2.5 particle increased by 1 micron per meter cube, there was an increase in death rate by 8%, which is really significant. So we have to take cognizance of all these things and keep it in mind that we're going to be in for trouble in the times to come.
Dr. Nangia, would the combination also increase the possibility of mortality? Would it push more people into a dangerous situation?
Yeah, absolutely it will, especially those who are in the high risk category. When I say high risk, I mean those who are in the extremes of ages. That means the toddlers and the elders, more than 60 years of age. Then those who are suffering with any kind of a chronic disease like diabetes, hypertension, asthma, chronic obstructive pulmonary disease, heart disease, lung disease, liver disease, all these cancers, immunocompromised state, these are the people who are going to be even more vulnerable to the effect of air pollution as well as to that of the COVID-19. So definitely it's going to be a double whammy kind of a situation for us here, where on one hand, air pollution would result in increased number of strokes, in heart attacks, in cardiac arrhythmias, cancers, respiratory tract infections, acute exacerbation of COPD. On top of that, we have COVID-19. COVID-19 also can result in heart attack, strokes, exacerbations of COPD. So, it's going to be a very complex kind of a situation where more than anything else, you also have to understand that these days, any patient coming into the emergency with breathlessness first has to be tested for COVID, because our first suspicion is that can it be COVID? COVID is manifesting in various ways. It is not that COVID patients are following any set pattern, that they only come with fever, cough and cold and then you label them as COVID. No. We've had patients with just coming in with breathlessness turning out to be COVID, denying any history of fever altogether. Just body aches could be turning out to be COVID. A sore throat could be turning out to be COVID. So in a situation like this, when they reach the hospital...
So doctor, what can people do? What can people do? Because yes. So what can people do? Because beyond the point, it's difficult to protect yourself from the air pollution. The COVID is out there in any case. So I think it's important to tell our viewers who are watching this that what can they do to be careful?
So I think first and foremost thing is that although we are going into a phase of unlock now where most of the things are opening up, people are getting back to work, people are getting back to normalcy, but we have to remember that we can't let our guards down as of now. We can't let complacency set in any which way. We have to continue with all those precautions that we've been following all this while of social distancing, of wearing a mask at all times, and hand hygiene. These are three very, very essential measures that we need to continue following in times to come. Especially because air pollution is also going to be there. So masks have to be a part of your lifestyle now. And especially, we may have to move on to the N95 mask now, rather than the usual simple mask that we've been recommending so far. So it is not going to be easy. I fully understand that. But then again, we can't take a chance at this time where we are already, fighting one battle against COVID. On top of that, there's going to be air pollution. And let's not forget, Diwali is also coming up now. It's just probably a couple of weeks away now. So we are definitely in for some kind of trouble soon.
Yes.
Dr. Nangia, on the Diwali issue.
Well, hopefully people will be careful during the festive season. Yes, Mr. Vasdev.
There are directions by the Supreme Court and by state governments over on the use of crack. I have another question for you.
Yes, please go ahead.
And that is, I'm asking Dr. Nangia because on the legal side we are there, but on the medical side, Dr. Nangia, I have a question for you. What is the impact of COVID coupled with on children under the age of 15 who are not going to school?
Okay. So, luckily for us, COVID-19 does not have a very serious kind of an illness in children so far. Most of these children have either an asymptomatic or a very mildly symptomatic disease. There are only very few, a very small percent of children who are lining up with complications, which is called this multi-system inflammatory disorder.
No, I'm not speaking of physical disorders. What is happening to the psychology insofar as the future growth is concerned? Because that's a matter of grave concern to all of us.
So basically, if you would talk about psychology, we actually conducted a study sometime back.
But I would...
Can I say something? I think what has happened...
Finish your point, Dr. Nangia, but I would request that we stick to topic. 1 minute, please. I request all of you, let me moderate this. You all are on that same, chat and I'm not, so let me moderate this. It's an important question you've asked, Mr. Vasdev, but I would request that we stick to the issue at hand. And of course, how children get affected, teenagers get affected psychologically is a huge issue. We've covered it on the show as well. But let me come back to the issue of what an entire population is facing over the next few days. And Jyoti, you wanted to come in with a point, and what I want to ask you is that what can we do? Is it all very bleak? We know right now that some measures have been put into place, but do we need to accelerate it?
Yes, we need to accelerate. There is a complete failure of governance, and that is very, very serious because already the country is reeling under, lockdown, unlockdown. The economy is suffering, people are suffering, but the first thing is health. And unfortunately, the problem of air pollution has gone on for the longest time. In Punjab, we are growing the wrong crop at the wrong time, and also it is, I think everybody understands the issue. Rice is a very water-hungry crop. It is being grown in the wrong state. Punjab is not a high, paddy needs standing water to grow. So Punjab is not the right place to grow it. It is also by growing this, we have all our godowns are full of rice anyway. We're exporting more than we're exporting our water out of the country. And now we have this Punjab Preservation of Subsoil Water Act, which came up in 2009. And all NASA data is showing us that actually the fires went up sharply after 2009. And all the smoke that now blows towards Delhi is because the winds changed direction in October. So I don't understand the purpose of having the Punjab Subsoil Act, which is telling farmers not to start planting, even if you're planting wrong crop, but at least if you're allowed to plant it at the right time, you would have harvested it by September. At that time, westerlies are there, so you're not having this smoke blow towards the dense areas of all the urban dense areas. There is a difference between emissions and exposure. Emissions should come down anyway, but if you are not able to bring down emissions because you are a failure as a government, then at least bring down exposure and save your people. This is a complete breakdown of the government from the top down, and every single party is complicit in this, and that is the real problem. Having these little solutions, appointing XYZ, telling them you have to do this, don't burn crop stubble. We know this happens every year. This is not a surprise to us. The only thing that is a surprise today, which was unexpected, was that COVID.
And especially in this year when we're already facing a pandemic. Jyoti, well said, and especially in this year when we're facing a pandemic. Let's remember those days of the lockdown for one thing, how the skies were blue and clear and how that was such a relief. Have we learned nothing? That's the biggest question we should ask ourselves. Thank you so much to all of you for joining us on this first big discussion this evening on a very, very important issue.